Congratulations, Dr. Lorne Scharf, on becoming the new, what's your official title?
The Chief of Staff.
Chief of Staff. Gee, that's like those old TV shows, ER and stuff. You're the boss.
It's a leadership role.
It's a leadership role. So what does a Chief of Staff do here at CCH?
So as the Chief of Staff, I'm responsible for the overall quality in the institution. I'm responsible to work with all the medical department heads, make sure all the patients are receiving the appropriate standard of care and quality of care. I deal with anything that goes wrong. I work with the administrative team to implement process improvements, to sort of bridge that connection between the people running the hospital and the doctors taking care of the patients to make sure that we're delivering the care in an efficient and effective way.
Now, you've been here in Cornwall, I think, since 2001.
Yeah, I started actually right here in this office where we're talking right now.
So what's the attraction to the community? Why have you stuck when so many other doctors have left?
Well, I actually came out here way back when I finished my training in Quebec because we were nearby, and I had an Ontario license and my Quebec license was held up in some red tape. Finally, I did get my Quebec license and I worked in Quebec a bit, but I preferred it here. I preferred working in Ontario. I've worked up in Thunder Bay and I've worked out in Barry's Bay, and I've gone around the Kitchener area. I've sort of done a little tour of the province, but I like the Ontario healthcare system. And when I finished my management training that I went back for, I did start to do a bit more work in Quebec, but I found once again that the Ontario accountability and measurement systems and the structure that was in place under the ministry in Ontario was something that I enjoyed working with more. So I returned full-time to Cornwall, and I've basically just always been happy here. I like the work, I like the patients. I find the people around this area are very nice to work with and very nice to work for. I enjoy the First Nations aspect of the healthcare. I like the hospital and the hospital management, so I'm comfortable here.
So what's the biggest challenge facing you now that you're the poobah?
Well, I think that the biggest challenge that's going to face the hospital and the physicians and our whole medical community over the next, let's say the medium term, the next 10 years or so, is going to be getting very efficient and very effective and tightening up our policies and procedures so that there's really as little waste as possible in the system. Things are as coordinated as well as they can be. We were not duplicating things. If people can get the right care in the right place, that is where they're getting it, that is where they're going. People occupying beds if they don't have to is something that is always a problem, because that translates into other people not being able to get their operation. At the same time, people going home from the hospital too soon and falling down is a problem too. So there's a big balance, and there's a lot of programs and a lot of ways of attacking these issues. And I'm there to work with the other sort of clever people that are making these decisions to try to make it work. And we think we can make it work, because we know what the best practices are, and we know what's working in other community hospitals. We're not afraid to borrow and steal ideas from other people, and frankly that's probably what we're going to do a lot of.
Now, a lot of communities in Eastern Ontario have a problem with attracting physicians, especially good physicians. I'm sure you face some of the similar challenges. Do you have any particular strategies in attracting good doctors to Cornwall?
Yeah, well, in the emergency department where I work, we've actually got the opposite problem right now. We have too many people that want to work there. And that's been sort of an interesting development, because we've always believed that if things are good for the patients, they'll be good for the staff. And we've done a lot lately to improve the emergency department, and because of that the patients are happier and the staff are happier, and the word really spread very fast, and people want to come work there. So we've actually
Can you give us an example of something that's been an improvement?
So the things that matter to the patients have to do a lot with flow through the department. People want to see a doctor on a timely basis. Well, I always think of patients as wanting three things from the emergency department. They want to be seen relatively quickly. They want to be treated with respect, and they want their care to be based in some kind of acceptable standard of care, best way of doing stuff. So we've attacked all three aspects there, and we think we've done pretty well. People are now being seen more quickly. They're being discharged more quickly. They're getting a good diagnosis. The ones that are in the emergency department are being put on evidence-based pathways to ensure that they are getting the right kind of care. And we're also measuring things like satisfaction levels and how happy people are with how they're treated. So all these things have improved, and we've had specific interventions targeting those facets of the care in the emergency department to make sure that they're improving, and we tweak them as we go. And things don't always work. Sometimes we make the wrong decision, but we go back and fix it up. So I think that has translated into happier people, and we know it has, because not as many people leave without being seen, for example. Mm-hmm. Not as many people leave before their treatment is complete. We have fewer complaints. In fact, we have about 15% more people coming. Mm-hmm. So we've actually generated demand. The word has kind of spread. There are many days where the wait in our emergency department is shorter than the wait in some doctor's offices. So we've actually brought more people into the hospital, which is a separate conversation, but it wasn't exactly what we intended, but not necessarily something that shouldn't have been anticipated. So because of that, the patients are happier, things are working better, the nurses, I think, are liking it better. Part of making a emergency department flow well is balancing everything. You know, having the right people at the right phases along the progress through a patient's journey, and when it's balanced, then nobody feels sort of overworked and dumped on. So I think the nurses are happier, the orderlies or the patient, the ERAs as we call them, are happier, and the doctors are happier.
As chief of staff, if you could wave your magic wand or your magic stethoscope and either improve one area or facet or add an area or facet to the services offered at CCH, what would that be?
If I could make one thing better, mm-hmm. Well, you know, my big thing is quality of care, mm-hmm. and quality of care is something that's not always easy to define. So what I would say would make things better is to keep measuring and benchmarking more and more stuff, and to make sure that we have some levers in place that we could pull to fix things when they're broken, and to put the right incentives and the right infrastructure and the right information in front of the people that are delivering their care to make sure that they do the best thing they can. I mean, my big philosophical belief, I mean, it's almost a religion actually, is that if the quality is better, then the patients will be healthier and the costs will be lower, because nobody wants to be sick. I mean, really, if you're a happy customer in the healthcare system and you're getting good care, you should, in theory, probably use less of it. So I believe that everything would flow from there. So my big push would be for best quality standard of care practices in everything from infection control to the medical departments to the emergency departments. Housekeeping. I mean, I do work on committees with the head of housekeeping. I mean, what he does with his people, you know, you don't realize it, but the people that clean the bathrooms, that will translate directly into post-operative infections.
Ottawa just had a big C. diff breakout.
And I'm proud to say we really haven't had a problem like that in a long time in Cornwall, and it's probably because of the hard work of people like our housekeeping staff.
How many cases of C. diff would we have a year in Cornwall at CCH?
You know, it's really, really unusual. And I couldn't tell you offhand, but
less than 40?
I would have to get the numbers, but that sounds about right. Mm-hmm. You know, when I worked in Quebec, I worked at one of McGill's teaching hospitals. We saw them every day, multiple times. So we're definitely below the average, mm-hmm. And that's because of the kind of work we do.
Awesome. All right. Well, thank you for your time.
That's it.
Yeah.
I thought you'd get me some tough questions.
would you like some tough questions? No, do you want to tackle bilingual nurses?
No, but I was all nervous about what you were going to bring up. No, okay. Thanks for doing this. I always
the camera's still on.
Is it? Okay. No, I always enjoy being interviewed by you. Come see me again anytime.
Thanks, Lorne.